Hi, my name is Micaela Hood. I am with the Pocono Record, and we are here with Elizabeth Wise. She is the president of Lehigh Valley Network Pocono Hospital. She's here to answer our questions that readers submitted. How are you doing today, Elizabeth?
I'm doing good, and thank you for this opportunity.
Yes, I actually wanted to thank you, Elizabeth, and the staff, the doctors, the nurses, all the medical staff that are helping with this crisis and this, scary pandemic. You guys are doing a wonderful job.
Well, thank you. We're the mighty Pocono team, and we have
Yes.
a lot of frontline heroes here.
Pocono strong.
Yes.
All right, so we have about 10 questions. The first one is actually from Aiden Dennis, and he wants to know if you will be accepting any 3D printed face shields.
The question is absolutely.
Okay.
Early on, East Stroudsburg University, Dr. Welsh, who's the president, reached out to several healthcare leaders, including myself, offering the option to do 3D printing. And yes, we are accepting any face shields or anything else that can be done on a 3D printer for personal protective equipment.
Okay, so how do you have to get in touch with Dr. Welsh then to do that?
She has the capability at East Stroudsburg, but if someone else has that capability locally and can do that, we certainly would accept those donations.
Okay, perfect. The next question is from Gail, and I don't want to mispronounce her last name. I think it's Shattuck. She says, or actually wants to know, if someone thinks they had COVID-19 in January, will it show up in blood work now?
So the answer is no.
Okay.
It would show up as negative. There's a lot we don't know about this virus. So we're learning as we go.
Okay.
The current thinking is the answer would be no.
Okay. The next one is from Marianne Dutter. She wants to know, if someone had coronavirus, can they get it again?
So very similar to the other question, the probability is very high that they will not get it again. But again, there's things that we just don't know about this virus.
Okay. Michael Doherty wants to know, when someone is diagnosed, is there an aggressive effort to seek people that they were in contact with?
So the answer is yes. That could either be done locally through an employer or the Department of Health, but there is tracing that takes place to look at who potentially the person came in contact with, how long the contact was, were people socially distancing or physically spacing themselves apart, to look at the probability that that person was exposed and may potentially be at risk.
Okay. And then I don't want to mispronounce people's last names. Britt wants to know, why are people from out of state who test positive for COVID-19 and in Pennsylvania and treated in Pennsylvania counted in our Pennsylvania data?
So what is happening is the attribution, which is where the numbers get counted, is really your address and where you physically live, not where you were treated.
Okay. That's interesting. I don't know if a lot of people know that. This comes from Goo. She wants to know, what is being done to keep the labor department healthy, to keep coronavirus away from women that are going to give birth? What is the hospital doing as far as disinfecting beds? And a second follow-up to that, are spouses allowed in the delivery room, and how do we know or don't know if they have COVID-19?
Okay, so this question could be applicable for women that are coming to deliver, or for any patient that's coming into our emergency room with a heart attack or a stroke. So what we are doing for visitors, particularly for women that are delivering, and they can bring one person with them during the delivery, is they will be screened prior to entering the labor room. We have a series of questions. We will check your temperature. If you are greater than 100, we will not allow you to visit. For our staff, we are requiring our frontline staff that are directly caring for patients to wear not only a surgical mask, but a face shield, gloves, and a gown when they interact with patients, particularly if there is fluid involved, which there would be in a delivery. And we have very rigorous cleaning processes in place, not only for our patient care rooms, but also high touch surfaces.
Okay. The next question is, sorry, these were submitted via email, so I don't actually have names.
Okay.
But this one goes back to the first question. How can someone donate masks to the hospital?
So we are accepting donations of personal protective equipment. I do want to shout out to our community. We have very generous people that have come forward to donate N95 masks, make hand sanitizers for us to use. So thank you, thank you. If someone wants to donate, please go to the LVHN.org website. We have a COVID-19 webpage that will direct them to how to make a mask, should they choose to do it, as well as other information on donations, how to get in contact with somebody when we're accepting them, and the location for those donations.
Okay, perfect. That's nice. I'm glad the community is helping you out.
They've been wonderful, honestly.
That's great. That's great. I was actually there on Saturday when the Wesleyan Church, so that was
wonderful.
It was a beautiful, beautiful event.
You don't know how many smiling faces there were that day, and from our staff. It really touched them.
Yeah, I don't want to cry right now, but it was an emotional moment.
It was really
nice. Okay. Next question. Is it safe to go to the emergency room? Heart condition, broken bones.
So the answer is yes. Again, we have a screening process in place to identify patients that particularly we are suspicious that they may be COVID positive. We mask them immediately, and we have a different area of the emergency room where we are treating patients that we consider suspicious or that potentially may be positive. And then we have another section where other patients, if they come in with a heart attack or a stroke or a trauma, that we will treat them.
Okay. And then lastly, Elizabeth, how prepared is the hospital for this pandemic?
So on a consistent basis, we are always assessing our resources. That includes personal protective equipment and how much we have available. It also includes other types of equipment like ventilators, and it includes our precious resource, which is our colleagues and our staff that are providing direct patient care. So we are always monitoring that. We have plans in place. We stood up what's called our incident command structure early in March, and we have surge plans in the event that we need to increase our capacity to care for our patients.
Okay, Elizabeth, thank you so much for taking our questions. And again, thank you to your staff at Lehigh Valley Health Network for keeping us safe. Is there anything else you'd like to add?
Yeah, I think the last thing I want to add is that we're not in this alone. You know, we're part of a larger network, Lehigh Valley Health Network. And so we have resources to bear even beyond here in Monroe County. And that's the strength of being part of a large health system.
Okay.
And I do want to again thank our community for their generosity. I think we may come out of this about 10 pounds heavier because we've got wonderful donations of food, personal protective equipment. And I want to thank you for the opportunity for people to ask questions and provide information. There is a ton of information on lvhn.org. And frequently asked questions. We're always posting new educational material. So that's another resource for people in our community.
Okay, great.
Just want to say thank you for allowing me this opportunity.
Of course. It was nice to meet you.